one?
So our primary research report is about exploring the safety of bacteriophage therapy. I'm Sophia.
And that's all.
And I'm Rati. So the biological question that was asked in this paper was if bacteriophages like ABSA01 are safe to use to treat patients suffering from Staphylococcus aureus. And the hypothesis was that bacteriophage ABSA01 is safe to use to treat patients suffering from Staphylococcus aureus. So there have been high mortality rates with patients that suffer from bacterial infections, and they become even more deadly when they're coupled with other illnesses. And due to the growing antibiotic resistance, phage therapy is now the area that is being looked into. And for this study, the safety and the tolerability of a specific type of bacteria or phage is tested to determine if this could be a possible therapy method for those with severe S. aureus. And if this study does become successful, it could also be a revolutionary treatment for those who suffer from MRSA, which is also a bacteria that has grown antibiotic resistance.
So the methods that were used include phage therapy, BMP, quantitative PCR, and whole genome sequencing. So 13 adult patients that were critically ill with Staphylococcus aureus were enrolled in Westmead Hospital in Australia, and they gave their consent to participate in the experiment. So phage therapy was given alongside antibiotic treatment, and phage therapy involves injecting a specific type of virus called a bacteriophage that targets specific bacteria. 3 of these phages, known as ABSA01, was administered twice daily for 2 weeks. And during the experiment, the participants' vital signs were monitored during and immediately after the infusion. And the chemical makeup of the blood was also monitored using the BMP. They were monitored for adverse side effects to check for safety. This includes pain, fever, low blood pressure, and tachycardia, which is rapid heart rate. And then afterwards, blood was collected from each patient and DNA was extracted. Quantitative PCR was used to determine the quantity of bacteria and phages that were still deadly to the bacteria were in the blood, and whole genome sequencing data analysis was performed using a bacteria called S. aureus as a reference. So for the results, no adverse reactions were reported following phage therapy. Inflammatory responses in the patients decreased, but researchers were unsure of how much of the bacteriophage therapy actually contributed since antibiotics were taken as well. So the antibiotics may have caused this decrease as well. And the bacteriophage was considered safe to use for severe Staphylococcus aureus infections. And the amount of bacteria overall decreased and the phages remained in the bloodstream. But future trials are needed to determine the actual efficacy of the bacteriophage. Luckily, no phage resistance developed during the course of the experiment.
Okay, so based on the results that was mentioned in the slide before, They tested for two main things, like the safety and tolerability and the phase and bacterial kinetics, plus the clinical outcomes. So when they tested the substance called ABSAO1 on the patient, they observed that they did not see any bad reaction or problem. This suggested that the treatment is safe and does not cause issues. However, now they need to do more research to find out if this substance can actually treat the infection. And for the phages and bacteria kinetics plus clinical outcomes, they looked at how well the ABSAO1 worked against infection. They found that most patients' infection improved and that the level of bacteria in the blood went down after treatments. They think that the special viruses might help fight the infection, but they are not sure if the antibiotics or the virus treatment was more responsible. To know for sure, they do need to do more research. However, we agree with the interpretation because the study focused on checking if the treatment is safe, not how well it works. The experiment was well designed with a proper control. It answered the safety question and opened the doors for more research to find out if the treatment is effective. We also like for the conclusion, the results of the research supported the hypothesis that the bacteria phrases ABSAO1 was safe to use, um, was safe to use given through vein, and it was accepted to serve the Staphylococcus aureus infection. It successfully lowered the bacterial level, improved more patients' conditions, and reduced inflammation. However, not all patients fully recovered, showing that more studies are needed to confirm how well ABSO1 works. The fact that the special virus stayed in the body after treatment is a good sign for the future research. Overall, they wanted to check if this treatment is useful adding for such infection.
So from this article, we can go in a lot of ways to study the effectiveness of bacteriophages. In the article, some future studies that were ideated were that there could be more controlled trials, such as two groups, with one being a negative control and one being the experiment group. Another study that was ideated in the article for future studies was doing a study but administering 10 plaque forming units once every 12 hours. And some future studies that could be done that were not mentioned in the article was that more patients can be used for the study to increase sample data, which can help with acquiring better results. The study could be redone to test validity, but it could also be redone with another bacterial infection or with an infection where we know that antibiotics will not work for, like MRSA. And the study could also be taken into account with the patients that have SRS coupled with other illnesses and split them into different groups so that we could see the individual impact of certain illnesses on SRS when coupled with the bacteriophage treatment.
And these are our sources.